every day and in every way. Enjoy that I find support. No matter the role you play, nutrient pack supplement for you and me. In your body, that I fight you.
Darvite nutritional supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Darvite from LB Pharma. Darvite, love yourself.
Every day, countless women and babies lose their lives due to preventable causes. But what are the root causes of this problem, and how can we work together to reduce these numbers? According to World Health Organization, every day in 2023, over 700 women died from preventable causes related to pregnancy and childbirth. Maternal and infant mortality in Nigeria remains a significant public health concern, with high rates due to combination of factors, including limited access to healthcare, poverty, and socio-cultural barriers. The way forward involves strengthening health system, empowering women and communities, and addressing socio-cultural barriers. We'll be discussing the maternal and infant mortality in Nigeria, the causes, and the way forward with our expert today on your favorite health TV talk show, The Physicians. Do stay tuned. It's another day on your favorite health TV talk show, The Physicians, where your health is our business. My name is Dr. Memuna Yusuf Kadri, and today we are discussing a very important topic, maternal and infant mortality, the causes and way forward. And there's no other person than the expert we have in the studio who is going to nip it on board. So if you are not with your family members right now, go call them, inform your neighbors so that they can understand why we are ringing an alarm on the maternal and infant mortality in Nigeria. She's no other person, and she needs no other introduction than the amazing walking encyclopedia, Dr. ALERO Roberts, a consultant public health physician and an associate pro, College of Medicine, University of Lagos. Great advocate. Is that what they normally say?
Oh, yes. Thank you very much. Yeah, welcome. Thank you for having me again.
Always looking amazing anytime. But of course, schooling us on the importance of healthcare and everything that related to healthcare. We must say thank you so much for honoring us every time we call you.
It's my pleasure.
So now we're talking on maternal and infant mortality, causes and way forward. I think we need Nigerians to understand the gravity of this discussion. What are the recent statistics? What are the things we are seeing on ground that we are shining our torch on maternal and infant mortality?
To be honest, the recent statistics are deplorable. And those recent statistics, as bad as they are, don't capture the full picture. Because you have to remember, so I'm a little reluctant to give out numbers. Because one child, one mother, is one too many. That's the honest truth. For the family that loses that precious loved one, it is just one too many. And then you have to think of the fact that a lot of this is underreported.
Yeah, right.
So we have a very bad habit of not recognizing the death of an infant or a preterm or a baby born before date. So throwing out those numbers for shock value doesn't really give us the emphasis, doesn't place emphasis where it needs to be placed, on that family, that man, those children that have lost a mother, that have lost a sibling, the man that has lost a wife, the mother that has lost a daughter. Yes, I mean, let's think about all those siblings that have lost a sibling.
Yeah, a daughter is
a friend, a neighbor. That's the real pain, and that's one where I would like us to lay emphasis.
So what would you say are the primary causes of maternal infant?
It was somebody who taught me this. Imagine, if you can, a big shoe pressing down on the pregnant tummy of a woman. SHOE. Sepsis, meaning infection.
Okay.
H, hemorrhage, meaning bleeding, both before and during and after. O, obstructed labor. E, eclampsia. Then you can add so many other things, but those are the 4 major causes. S, shoe.
Shoe. That exactly what I was going to say. Shoe.
Shoe.
Imagine a
that
big shoe.
pressing down on the pregnant tummy of a woman. And you will never forget.
I will never. You've just taught me something.
That's good.
And I love acronyms. So this is
Yes.
just something. And
Causes of maternal mortality. Shoe.
And it's a big shoe.
And it's a big shoe that is pressing down. And, so when you think of that, now, when you think of sepsis infection, I mean, the myriad of infections, I know we've talked about it before, malaria being one, all the way down to, poor hygiene, water and sanitation hygiene practices. You've got the bleeding. And, the funniest thing about the bleeding is worse in women who have anemia.
And
the paradox.
This woman that is already not eating
well, not eating well,
has anemia, and they're now bleeding again.
She's at higher risk of bleeding.
Double jeopardy.
She's at higher risk of bleeding, and that bleeding can be before delivery, during delivery, after delivery, after delivery.
My case, the last day of my house job, I will never forget, because of it was bleeding after delivery, postpartum hemorrhage. And that was the era where they brought this jacket that you wrap the woman in. So, of course, we were supposed to close by 8 a.m. You go home. Last day, but I was still in the hospital till 9.
Yes.
Because I just was invested emotionally that this woman must survive.
You know, how would you tell your backhand? How were you going to tell your backhand? You could not have. You could not have. That hemorrhage, and then you can imagine when that hemorrhage, you've delivered the woman, the baby mother, you've heard the voice of the mother, you've heard the voice of the baby, you've carried them from the labor ward, you've gonna put them in their room, in their bed, they are lying in bed. The next thing you're expecting is that baby to breast or and then they start calling you, doctor.
Woman is
peeled back the bed sheets and the
blood everywhere.
is soaked. Where we begin to start? So these are all the things, and we are giving, that is the shock value of the stories that we tell. And every woman, every person in healthcare has a story to tell, like literally. The midwives, the nurses, the doctors, the physiotherapists, even the paramedics, everybody, they have stories for days. Running backwards and forwards, blood bank.
So how does access to healthcare now contribute to this infant and maternal mortality?
Very good question, Dr. Mumuna. Very good question. Let's start from the very beginning.
Exactly.
The woman misses her period.
Okay, yes.
Let's start from the woman misses her period.
Pregnancy test positive.
She has not even
done. Okay.
What does she know to do? Let's start there, because I want to approach it from the community point of view, from the person point of view, from the individual. What does she know to do? Let's just assume she's got a modicum of education. Yeah. She's gotten to at least JS3.
Exactly.
So she's gotten some science, she's gotten some education. What does she know to do? Let's say she knows to go and get a pregnancy test, find out if she's pregnant. After that, what is the advice that she's going to get? Who does she talk to? Where does she go? Because all these things, these are what we call the dynamics of decision making. Now, if she's married, she's got a good mother, she's got a good mother-in-law, she's got sisters, she's got neighbors and friends, she's had all these conversations, she knows what to do instinctively. Almost instinctively, in the sense that she does not even realize where she got the information, but she knows what to do. Does she know what to do? Does she know where to go? So she goes and talks to the traditional birth attendant in her yard, or the mama nurse in her yard,
and there's always that mama nurse.
So thank God for those mama nurses. I hate, thank God for those mama nurses who have stayed in their communities, and then we continue to empower them to give the right information.
Yeah.
So she goes to mama nurse and says, Mama, this is what has happened. Hopefully, the right information she gets is go and register at the primary healthcare center near your place. That one is free of charge. Yeah. That is free of charge. That's why they will now do the urine test, the pregnancy test find out if you're pregnant, and start giving you advice. My prayer is that they will tell you, start your folic acid. Folic acid in this day of mighty costs is still less than 1 kobo per tablet. You are right. But that prevents all kinds of congenital problems. So you start your iron and folic acid. You don't engage yourself in risky behavior. You start eating right. You sleep well. You take your little bit of exercise, and then you allow the pregnancy to settle very well, and you start boy. If you are registered at the antenatal clinic, they will tell you how often to come. They will tell you what you need to do. They will tell you what you need to get ready. They'll start teaching you about what to do. So that access to healthcare is vitally important. And when we say access to healthcare, we are starting from what did you hear in school? Who is giving you advice in your house? Who do you know to go to? It's not when we say access to healthcare, we are now looking for teaching hospital, which is a tertiary institute. Until you see Professor Soto and so or OLG department, you have no. That very first access to healthcare is so vitally important.
Now, this takes me back to the social determinants of health. What role does it play in maternal impact?
There you go. In fact, you have given the whole tour. You called us everything we need to do. So what are the social determinants? Well, it's like going to add poverty. And poverty in all its ramifications. Not just poverty of no money in my pockets. Poverty of knowledge. Poverty of thought. Poverty of access. Poverty of support.
Yeah.
Poverty of the access to justice and to welfare. That poverty is a major social determinant of health, because you will find that maternal and infant mortality is higher in those cadres of the society that are on the lower end of what we call the base of the pyramid. Just to get to the primary healthcare center alone, it's a problem. It's a problem. The cost of Okada, because the primary healthcare center is not within walking distance of where they live, because they live on the very fringes of society. These are the things that we are not thinking about when we talk about policy and governance. These are the things that the so-called people in policy and governance are not remembering to talk about. These are the really vulnerable population who, unfortunately, nowadays make up a major proportion of our population.
We talked about the role the community plays in intervention. So what is that role?
It's a mighty role. I mean, it takes a village to bring up a child. We must live in multiple generation farming. So the role of community in managing any departure from health is major. So let's talk about it with respect to maternal and infant mortality. The woman gets pregnant, the young woman gets pregnant. Everybody is involved because everybody is happy about pregnant. Well, then you've got sensitivity. We have a pregnant, Who's bringing the pepper soup? Who's bringing the origi? Who's bringing this? Who's doing the... Yeah, exactly. So that communal joy is always there. Is she getting the right information? Is she getting access to the right kind of nutrition? Is she getting access to the right kind of care and support? Now, care and support here is not just the health care. Because we've all been there. First 3 months of pregnancy, you are vomiting all the time. You are just all reminded, So does she have that kind of care and support? Her sisters, mothers coming to pamper her a little, tell her that don't worry, it's going to be okay. Everybody comforting her by regaling her with their own version of their own stories. All this is part of the community-based support. And it's so vitally important because here we're having a good laugh, and people don't realize that at the end of the day, laughter is the best medicine. So you're surrounded by people who are giving you the right advice, the right information. They are there to answer your questions. They are there to alleviate your anxieties, your concerns. It makes it so much easier, and we are now ready. So we are getting all the information about what to do, what to buy, what not to buy. Most importantly, you are getting information about breastfeeding. My favorite topic, I know. Yeah. Who is even looking after the other children while you are dealing with this pregnancy? Because I've just gone through that with my daughter. And she was so uncomfortable. Let me just put it like that. But she had other children, and the community stepped in. Okay, we'll do the school run, we'll do this, let's do that, and so on. That community is so important. Within that community, you will find mama nurse. Yeah, you will find the primary health care center. You will find the village health worker. You will find the community health extension worker. People who are coming to check, and among those should be people who are coming to at least do her basic vitals, her blood pressure, check whether she's anemic, give her advice about what to eat or drink within what is available. Not everything has to be tablets and syrups. You're right. You know, the best that thing is from food. Yeah, among foods that we eat. Exactly. All this is part of the community support. Helping her to recognize danger signs. Yeah. Because very often it's you, and you think, oh, this vomiting, don't worry, it will soon pass, it will soon pass. It is somebody else that will come and say, I don't like the way your face is looking. I don't like the way your eyes are sunken. Let me see your tongue. Let me see your fingers. Let me see your fingers. Like that is the community support.
Like visiting a couple, like the baby, the lady was very happy that the child has been sleeping for the past 8 hours. I said, no, bring that baby. And at the end of it, the baby was hypoglycemic. In fact, the baby will have just passed them. And yeah, she was just rejoicing, my baby is still sick. So that is very important community support. But what are the initiatives, intervention? Because now, way forward, which initiatives have actually worked for us here in Nigeria?
One that has worked, surprisingly, getting the men involved.
I don't think that is only a surprise. I think it's something that we need to be nipping on the sword.
Get them involved on time, by whatever means. We started it with the family planning and contraceptive. We've started it with adolescents, reproductive health. We've started it in so many areas. Getting the men involved, now is it even easier. Getting the men involved in infant nutrition.
Yep.
From a pocket point of view. People for the social media user. Pocket point of view, getting them involved very much earlier on, and discussing with them what the danger signs they need to be on the lookout for. Yes, that's very important. Another one is promoting income generating activities.
Yes,
the issue. Women need to have the financial muscle to be able to access health care as and when they need, because they are going to need it for their children.
So there's a recent outbreak of a man who refused to sign for the wife to have a CS, and she eventually passed away because the man didn't have money. You see your take on that?
Well, it's immensely sad. And this is what we started this in the area where we practice our Save Motherhood Initiative. UNICEF was running the Safe Motherhood Initiative, SAFE, and we changed it into SAVE, encouraging mothers to save into
like an ajo, and
because if she had money, I think she would have said, no, and they would have just given her the money, and then she's paying back over, because you're going to have 2-3 babies, I hope maybe 4 perhaps. So this esusu is something that you are doing, and the women, they are putting whatever little they can, but there's an envelope of money available, and it's usually kept in the charge of the officer in charge and the PHC, and she knows, because she knows who is coming up for delivery of emergency situation. That fund is available, because once there's life, we can pay back.
You're right. When there's
less, you can pay back.
That is a good takeaway.
So getting women into encouraging more income generating activities, and empowering women to take those financial decisions so that they feel empowered to take. Because if the husband didn't have money, and in this present day Nigeria, do you know the number of men who don't have money?
Plenty.
So, for the woman to know that, okay, my husband, this is the situation, I don't have money. Okay, mama nurse,
break that safe.
Thank you. It's time. Do you understand? She has the financial ability to be able to take that decision and say, okay, Baba Labaja, Emma, don't bother. Okay, just be looking for. Meanwhile, this is an emergency situation, and that's also very important.
Where does the government come into play in this? Because the government intervention, and I want to speak from that angle of the government. Why? Because you are a community builder, you are training doctors from the very lower cadre. So speak on that angle. How can government work together to reduce? Because our maternal and infant mortality is still very high. And like you said, we don't want to throw figures, numbers out here, but it's very high. When you look at
very high. There's no doubt.
so where does the government intervention come in? How can we work together, government ensuring that we reduce these numbers?
To be frank and fair, you know me, I can throw shade at government. They had me. Nothing is too hard in my mouth. They've done their worst. But to be frank and fair, every single policy that is needed to prevent maternal and infant mortality, the government has written and implemented.
So what's the problem?
Implementation, execution at the lower level.
So who is in charge to ensure that execution?
That's where we come back to the community-based intervention strategies that you are talking about. We are. You cannot expect the government, okay, you are watching me do water, you are watching me do water. I say, oh, government, come and take me to toilets. Really?
Really? That's a good narrative.
That's how bad it's gotten. Everybody is expecting government to come and take the spoon, lift the food from the plate, and put it in my mouth. No,
that way.
it doesn't work that way.
We need all hands on deck.
Everybody needs, the policies are there. The policies are there. The structures to implement the policies are there. As bad as the last 3 administrations have been, primary health care has been strengthened.
In fact, the new government now said that they are building more infrastructure, but my major concern is human resources.
It's the human resources. So yes, government needs to do a whole lot better in that area. And it's not just a matter of increasing salaries.
No.
Because those of us who were saying that not sustainable, it is not sustainable. That's not what we went with. It is increasing everything, all the system. I want where my children can go to school. I want where I can safely go to market and buy food. I want that food to be available in the market, which means there has to be security from food production right in the farm to where I can get it.
Electricity,
everything, transportation, security. So it's an all-round thing that needs to be put in place.
Time is always a big issue for us. But before we go away, I want you to speak to that one woman today, that one man today, that one auntie, that one uncle, that one neighbor, that one policymaker, that one concerned Nigeria about the maternal and infant mortality, the gravity of it, and what they can take away from this topic.
Please do not be that person. Please do not be that person who loses a loved one to either maternal mortality, the death of the mother, or infant mortality, death of the baby, and you could have done something and you did not. If you take anything away from this, register at the primary healthcare center near you. If there is none there, raise the alarm with the local government chairman. You know that has always been my favorite. Have your local government chairman's number on fast dial on your phone and tell him or her that the primary healthcare center near my place is not working. Where is the nearest one that is working? Any woman that is pregnant, please eat well. Take your folic acid supplementation. Register at the primary healthcare center near you.
Thank you so much. You can hear it from our amiable Dr. ALERO Robert. She has broken it down. Please don't lose a loved one because you didn't take action. Take action today. Be aware that maternal and infant mortality is our reality. We are still very high up there according to the World Health Organization, but we can do something. She said something, and I want you to remember that if the government gives you water to drink, will the government also come and tell you to go to the restroom to wee? No, when you want to win, you will go to the restroom. So we need all hands on deck in ensuring that collectively we are working together to strengthen our healthcare system to reduce maternal and infant mortality. Until next time, my name is Dr. Memuna Yusuf Kadri, and please follow us on all our various social media platforms. And if you want to be a part of the show, go to our website www.thephysicians.ng.com and you can fill the form and you'll be here sharing your story or even talking from a point of knowledge. Thank you and God bless.
Every day and in every way, enjoy that I find support. No matter the role you play, nutrient pack supplement for you and me. In your body, that I fight you.
Daravite nutritional supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Daravite from LB Pharma. Daravite, love yourself.